One of the biggest problems in hyperbaric medicine has been the failure of the medical profession, and in particular the hyperbaric medicine specialty, to understand its own therapy. And despite science, despite evidence, it is a continuing fight to get the doctors to acknowledge the science and the evidence of this. What I have found, and this is heretical to say as a physician, but the only place where I have found a truly unbiased adjudication of scientific evidence is in a bench trial, a judge trial in a court, where you have an intelligent individual weighing the scientific evidence presented by doctors on both sides, the plaintiff side and the defense side, and being able to see the evidence and make an unbiased decision. And this has been proven time and again. And probably the most dramatic one was a case many years ago of a young man, 32 years old, poisoned at a toxic Superfund cleanup site where chemicals had caused damage to his entire body, but liver and brain. And he got referred to me to try to see if I could treat his brain injury. And I did, and he responded. And what I had done, though, was get a picture of his brain before and after treatment with brain blood flow imaging, which was highly disputed in the medical community because, again, people had not understood this tool and how it could be used for a wide range of neurological conditions. And so what ended up happening was I had done the scan of his brain before we started to treat him. And what I had also done was brain scan under an institutional review board approved protocol, 75 individuals who were neurologically normal. No alcohol, no drugs, or at least not with a significant habit, and so on. But in other words, neurologically normal people from the population. And these images, though, were so powerful that every time one of our cases ended up in court in these early years, the defense attorneys tried to get them thrown out of court and excluded as evidence, claiming it was junk science, based on the Supreme Court decision in 1988 of Merrill Dow. Every time that one of my patients, where we'd used this form of imaging, SPECT brain blood flow imaging, ended up in court, the defense attorneys were trying to get it thrown out of court as junk science. And the whole junk science law was a Supreme Court's decision in 1988, Dober versus Merrill Dow, where the Supreme Court established the rules for what could be admitted as scientific evidence. SPECT brain imaging is solidly scientific, but the imaging is so dramatic that no defense attorney wants to see it in court showing improvement of a plaintiff's brain before and after a therapy, because it essentially makes the case that the brain was injured and the patient was damaged before the therapy was done. And this happened with our divers. And now with many of these Dober challenges I've had, all of them have gone in favor of the patient and the imaging. But the one most dramatic one was in federal court with this toxic Superfund cleanup site. And the morning of my testimony and the Dober hearing, it was called the Dober Challenge, I went by the office to pick up the printed x-rays of his brain scan. And while I was there, I also picked up one of the normals that I had done, who's the same age as this young man. The paralegal in our practice who helped us with all the cases that got subpoenaed and ended up in court was in the office early that morning, and I said to her, hey, I just want to test something with you. I have this guy who's been injured, and I've got a normal, and I've got 2 scans, and I want to see if you can tell the difference between them. And she was easily able to see the difference in these 2 brain scans. So when I got in court and testimony and I was being questioned, and they asked me about the brain scans and what did they show, I said it clearly showed that this patient had an injured brain, and after treatment it was improved, and clinically he was improved, it all matched. And I said, I've got normal patients' brain scans that we can compare to. You can see this. And the judge said, hold on, wait a second here. And he interrupted the attorney that was questioning me. He said, Dr. Harch, you have those scans? You can show me. I said, yes. And so I pulled out the scans, and he said, let me look at them. And so here I am in the federal courtroom, judge is up here at his bench, and I'm in the witness stand right next to him. And we're holding the x-rays up to the overhead lights in the courtroom. And I'm pointing out to him, here's what a normal brain looks like is very smooth and homogeneous blood flow, meaning it's all the same color pretty much in the brain. And I said, when there's been a diffuse injury like this from chemicals, you have a irregular pattern of blood flow, and it's very heterogeneous. And you can see that with the patient here. And then here he is after treatment. It now looks more normal and smooth. And the judge is going back and forth and looking at the scans and the light with me. And he's nodding his head. And he goes, I see, yeah, well, that's the normal. And yes, oh, you can see this. And right, okay. He goes, I understand. Very clear. Okay, Dr. Harch, thank you very much. Here, you can take your, we're done. And the defense attorney jumped up and screamed, no, you cannot allow him to backdoor this evidence into court. And the judge, everybody in the court was like, whoa, look at this outburst. The judge said, I could see his name, Mr. S. He goes, I am about to rule from the bench. He said, unless you've got more evidence contrary to this, he said, I'm ready to rule. And I would encourage you to get with the plaintiff's attorney and settle this case before I issue my ruling tomorrow morning. Dr. Harch, we're done. You can leave. And I ended up going out of the courtroom, and then there was more of a discussion and argument. And I packed up, and I ended up going to my car, which was in the parking garage and on the top floor, or the top level of the parking garage. And as I was coming down the circular thing, I got behind this car, this big old Lincoln Continental. It was packed with these 5 guys, and the car was just rocking and rolling and bouncing along. And these 5 guys were in there, hands were going up, and people were high-fiving, and they were just partying, rocking and rolling. Turns out it was the plaintiff's attorneys. And it turned out that it was obvious. The next morning, the offer came from the defense, and the case settled for $1 million more, which was 3 times the amount that the settlement was before the judge had seen the brain scans. It's burned in my memory, but it was such a memorable event because it was an acknowledgement of the science. And the defense had brought in these experts in SPECT brain imaging, radiologists, who put on this dog and pony show and showed all this stuff about how I couldn't use this to help in the diagnosis and treatment of this patient. And they were soundly defeated.